we bang the hottest hip hop and R&B. It's your girl Shani Sweets, the sweetest little thing in your ear. And I told you I had a special guest in here. I have the physician assistant Kerry Mackey. Is McKay?
It's Mackey.
Mackey.
Yeah.
My apologies. Kerry Mackey here with me. He's come here before, but you're back again for Men's Health Month here in June. So first and foremost, how are you feeling?
I'm feeling good. You know, it's men's health, so I definitely got to be at the forefront of everything, front and center.
So yes, you have to make sure you're here representing, because I do get a lot of the ladies that come through. You come through like every now and then, here and there, but I'm glad you came today. Now, June is Men's Health Month. Why is this an important time to encourage men to take a closer look at their overall health?
Yeah, I think June's a special month because it puts the emphasis on men's health. It reminds us that health isn't just about living longer, it's about living better. Too often men are taught to power through symptoms, stress, and fatigue, but prevention is one of the most powerful tools we have. So now that we got some special time to put an emphasis on it, I think it's important that, we try to focus on reducing quality of life, through more preventative methods.
That's dope. It's also Father's Day falls in June as well. So I know a lot of times dads start reflecting on their children and their legacy and stuff like that. So you want to make sure you align that with taking care of yourself. Now, what are some warning signs or early symptoms men should never ignore, even if it seems minor at first?
I think one of the biggest things with us men in general is we tend to dismiss stuff all the time, and so a big mistake is, dismissing symptoms because they're not severe enough to stop us from working through them. And for us as providers, we think if we can kind of work and function, we're good. So if you start to notice symptoms like persistent fatigue, you start to notice your weight changes start to happen, or chest discomfort, shortness of breath, any type of headaches or changes in the way that you carry yourself on a day-to-day basis, those are all early indicators significant medical conditions could be brewing, especially like men's health stuff, right? So erectile dysfunction, for example, is often one of the earliest warning signs of cardiovascular disease. It's just not a sexual health issue. So it's a plethora of things we could kind of be aware of and continue to monitor for.
Okay, so that's very, very important. And some of those things like that you don't really think about. When it comes to men's health, like what are some of the most common health issues you see in your patients? And what should people be paying more close attention to as they get older?
I think it's so variable as we kind of go across the spectrum of ages because things kind of change and evolve. So I would say, a lot of men start coming in around the age of 18 and getting checked out, and it's a perfect time because between age 18 to 30, typically I see things like anxiety, untreated depression, ADHD symptoms, poor sleep habits, metabolic profiles changing, so people start to gain weight. There's some substance use, people trying to learn how to cope with stressors coming into adulthood. Even starting to see some elevated blood pressure at that point in time. And then as we get a little bit older, from 30 to 50, you see more stress-related conditions. So the hypertension, diabetes, cholesterol issues, that weight gain further propagates, and then also testosterone concerns. So we start to worry more about the heart, and then when men get around the age of 50, we start to worry about things like our prostate, our cancer screenings, various cognitive healths. Even people start to see some regressions in their neurological thinking. So the reality is that chronic diseases don't often start when symptoms appear; they begin years earlier. That's why regular checkups and preventative screenings are valuable and important even at early stages in life. So the goal isn't simply to add years to your life, it's to make sure that those years are healthy, active, and meaningful.
Yeah, I feel like it is very important. We want to continue living in our community as long as we can, making sure we're healthy, can have fun. There's just so much more to life, and taking care of yourself can seem scary a little bit, but at the same time, I feel like it's one of those things, once you do it and you get a routine of checking on yourself, you just feel a relief knowing that you're good. So like with men, why, do they tend to delay seeing a doctor even when early prevention could make a life-saving difference?
It's like I mentioned earlier, I think men in general, we tend to wait until things are, broken before we start to pay attention to it. I think a part of it's cultural, right? Men grow up believing they're supposed to be the provider, the protector, the one that handles problems on their own. So they become so focused on taking care of everybody else that they unintentionally neglect themselves, right? So there are other reasons too. Some men might be afraid of what they may hear. Sometimes you hear people say no news is good news, and that's not always the case when it comes down to your health.
Right.
Others don't realize how serious the problem is until it, develops into a big issue. So I've also found men, make the mistake of endurance for health. They think because they're still going, because they feel fine, that everything's okay. And unfortunately, some of the most dangerous conditions like high blood pressure, diabetes, depression, and heart disease, they can progress silently for years. So waiting until something becomes unbearable may feel easier in the moment, but it often makes treatment harder and it makes the outcomes worse.
Yeah, you guys got to be a little more open, a little more, eager to let your guards down and let somebody help you. I think we all do, men, women, it doesn't matter. We have that chip on our shoulder, that ego or pride where we just want to be superwoman or superman, and we're human, all right? So you got to make sure you take care of yourself. If someone, specifically a man during this month, is listening today and hasn't seen a provider in a while, what would you say to encourage them to take that first step with Advanced Community Health?
Yeah, I would definitely tell them, your provider isn't there to judge you, they're there to help you. Doesn't matter if you haven't been seen in 1 year, 5 years, or 20 years. The most important step is simply deciding to start. Real strength isn't in ignoring your health, it's taking ownership of it. The healthier you are physically, mentally, and emotionally, the better equipped you'll be to show up for your spouse, your children, your friends, co-workers, and most importantly, yourself, right? It's never too late to take that first step, but today's a great day to start. The appointment you make this week could be the decision that prevents a serious health issue years down the road.
Now, speaking of that appointment that you guys need to make, where can people learn more about Advanced Community Health Services and how to book an appointment?
Yeah, so you can definitely reach out to us at 919-833-3111. We are located at 1011 Rock Quarry Road. That's our Southeast Raleigh campus. That's where I practice. Or you could go online and find us at advancedchc.org.
Amazing, you guys, you heard that. For more information, visit advancedchc.org or call 919-833-3111. Advances providers are here to support you and all your health needs. And of course, they're going to come through High 97.9 every month and, drop some gems on how to keep yourself healthy, your family healthy, and, keep listening to us and going to see them. Don't go nowhere. We're going to get back into the vibes. I got Dave and Tim's Rain Dance right here on High 97.9.